Today we will be learning about Ethiopia. I'm Carly, and I worked on this project with Matthew Bruyere, Melissa Galindo, myself, Carly Lizer, and Brianna Woodworth. So before we get started, we figured that we would want to start with some interesting facts that most people wouldn't know about Ethiopia. So to start, Ethiopia has a 13-month calendar, which means that they're 7 years behind the rest of the world. Along with their own calendar, they have their own time schedule. They believe that it's less confusing that the clock starts when the day does. So sunrise is at 1, and the sunset is at 12, and all the other hours between that are the other 12 hours. Another fun fact is that Ethiopia alone, there are over 80 languages spoken, making it one of the most diverse countries in regards to language. English is the language of the educational systems. Considering Ethiopia was initially founded in 980 BC, it is the oldest independent nation in Africa. Finally, for all the coffee lovers out there, Ethiopia is the home to the discovery of the coffee bean. It happened when a herder found his goat eating a bush that he didn't recognize, and it ended up being what we call the coffee bean today. So looking at Ethiopia's health profile, it is clearly different than the US. The life expectancy of people in Ethiopia is a lot lower than those in the US. The life expectancy of males is 65, and their female counterparts being 69. In our textbooks, the chart shown deciphers different birth rates from varying countries. Although the US has more advanced healthcare technology and isn't the lower income country category like Ethiopia, they have significantly less births per 1,000 people. As of 2015, the birth rate per 1,000 people was around 33, whereas here in the US, it was around 13 per 1,000 people. Another thing that poses great risk in Ethiopia is the proportion of mother-infant deaths during pregnancy and birth. The infant mortality rate of Ethiopia is 39 deaths per 1,000 live births. Unfortunately, the death rate of children does not get any better, because the children under 5 years old, the mortality rate is 51 deaths per 1,000 births. According to the CDC, the 10 causes of death listed are the top 10 that trouble the people of Ethiopia. Similar to the US, heart disease is a clear and prevalent issue along with cancers. Although cancer is quite prevalent, most individuals will not have access to radiation therapy because access to radiation therapy per 1 million people is less than 1. However, another leading cause of death is maternal and neonatal death that occurs during birth. The USAID has some impact on the maternal and child death rates, and that will be discussed later in this presentation. The bottom chart in the middle of the slide represents death rates from cancer of female reproductive systems. It shows that clearly the people of Ethiopia are affected by cancer, especially breast cancer and cervical cancer, and that it plays a big role in mortality rates. Population. The current population of Ethiopia is 118,764,665. That is equivalent to 1.74% of the total world's population. 21.3% of the population is urban. Median age in Ethiopia is 19.5 years. It's expected to surpass 20 million by the end of 2049. The population is growing at about 2.7% annually with no projected peak year or a period of decline. Ethiopia remains one of the poorest countries in the world due to its rapid population upsurge. And if you look at the chart, you can see it exponentially increase over the years. So when considering the demographics of Ethiopia, there are various ethnic groups such as the Oromo, Arithmetic, Tigrian, Sidadama, and many others. The age groups are very diverse, with almost half the population being children 14 years old or younger, followed by the age group of 25 to 54-year-olds. It is quite clear to see that 65-year-olds and older make up only around 3% of the population, which means that the population is typically made up of younger individuals. The graph to the far left shows crude deaths as well as age-standardized deaths in various countries. It is clear to see that the age-standardized death rate in Ethiopia has the highest 100,000 people. When talking about education, the book we discussed that 30% of children were enrolled in preschool, 65% were enrolled in primary school, but only 15% of adolescents were enrolled in secondary school. So geography. So Ethiopia is part of the Horn of Africa. It has an area of 1,127,127 square kilometers. Their terrain consists of high plateaus, mountains, and dry lowlands. The high mountains have crater lakes, deep canyons, and abysses, savannas, and deserts. 85% of the people are dependent on the fertile farmland, three major crops being coffee, grain, and castor bean. Susceptibility to earthquakes, volcanic eruptions in the active Great Rift Valley. Some environmental issues include deforestation, overgrazing, soil erosion, water shortages, and desertification. Their climate. So they have pretty hot temperatures in the lowlands. Their altitude is about 8,000 feet. They have two primary seasons. They have a dry season, which runs from October to February, and a rainy season for the remainder of the year. That rainy season is divided into small rains and big rains. The small rains run from February to April and are generally intermittent showers. The big rains are from June to September and bring heavily daily precipitation. Their average annual rainfall is about 50 inches. Daytime temps are consistent throughout the year. Dry season has bright sunny days with moderate and cool temps, with the average temperature being 62.9. The night temperature drops to low 40s. So environmental issues. Ethiopia's primary environmental concern is its high prevalence of droughts and the risk that this prevalence might increase. The droughts are a serious concern because they mainly affect the areas that their predominant issue of food security within the country, which has been even worse in the past year due to the civil war. As reported by one of the articles of Ethiopia's climate, it is estimated to increase in temperature by 2.9 Celsius by 2050, with a concurrent increase in the prevalence of droughts. This review also found that Ethiopia's climate research infrastructure is poorly prepared to handle this crisis, despite the government's commitment to having a green economy. So their government. They're a federal democracy republic of Ethiopia. They have a president, and their constitution was adopted in 1995. They have an executive branch. This is the highest branch power, which is invested in the prime minister. They have a current prime minister named Abiy Ahmed. The president and prime minister are indirectly elected by parliament. There's a judicial branch, which has a federal Supreme Court, and they draw up and submit Houses of People's representatives and administer the budget. Then there's the legislative branch. Promote unity of the people, it manages the implementation of the rights of the nations and input on federal and state tax resources. The House of Federation has 110 members elected by indirect vote. Healthcare system. So according to our textbook, the healthcare system is severely lacking adequate help and support in comparison to its population. As stated in our textbook, for every physician, nurse, or midwife in Ethiopia, for every 3,570 residents, whereas the U.S. has a ratio of 1 to 82. As seen in the bar graph, comparing different countries and availability of surgeons, anesthesiologists, and obstetricians, Ethiopia barely is even shown on the graph, meaning that they have less than one of those medical professionals per 100,000 people. The textbook also discusses availability to dentists. Specifically for Ethiopia, they have less than one dentist per every 10,000 people, meaning that one dentist has the responsibility of taking care of more than 10,000 people. With Ethiopia being the low-income country they are, it would be assumed that they are to spend less on pharmaceutical products annually. When looking at how much annually the average person spends on medication in the U.S., it comes to around $1,000, where in Ethiopia it is an average of $5. This could be due to lack of accessibility to medications, vaccines, and etc., or just the lack of income Ethiopia has. Along with medications, they also spend significantly small amount on healthcare in general, totaling less than $200 annually. USAID is Ethiopia's largest donor when taking into account all of the other help and aid they are receiving. USAID has been able to give them over $4 billion for healthcare alone and totaling over $13 billion over the past 20 years. This has helped enable Ethiopia to reduce their overall mother-child mortality rates, while also decreasing diseases like malaria, TB, HIV, and AIDS. Concerning mother-child mortality rates, the USAID's partnership with Ethiopia has led to an improvement in the type of healthcare provided by letting the people of Ethiopia have access to family planning, nutrition, and sanitation and hygiene in the household, which as a result, has helped provide more stable and safe environments for families. So, human rights issues. Ethiopia is currently experiencing a humanitarian crisis as a result of the Tigray Civil War, which is listed as one of the World Health Organization's 20 current world health emergencies. The war has been ongoing for the past 11 months, since November of 2020, as a result of opposing political beliefs between the Tigray region of Ethiopia's government and the country's primary government. Due to the conflict and the resulting lack of protection, many human rights violations have been and continue to be committed by both factions, with most of these crimes being against the civilian population of the Tigray region. Human rights continued. The war and conflict invariably result in the human rights violations as noted by the World Health Organization and the Human Rights Watch. These are the current abuses being committed by Ethiopia: intrajudicial killings, indiscriminate bombings of civilian sectors including schools and hospitals, mass killings of civilians, sexual violence against women and girls, and arbitrary detentions. Socioeconomic status. Ethiopia has a large population in Africa, but despite it is economically downtrodden and is ranked as low middle income country. Despite this country has been steadily growing, which can be seen through the growth of its Human Development Index score, which is a composite score based on country's life expectancy, average expected education level, and income. This low socioeconomic status has resulted in public health issues for the country, with a major concern being growth stunting in children. In 2000, 58% of children in Ethiopia experienced stunting. This has decreased by 38% in 2016. However, this is still an alarmingly high percentage. A meta-analysis published in 2020 found that this percentage has now increased to 41.5% based on a review of 39 articles. The current civil war has no doubt also exaggerated this trend as well, especially in the Tigray region, which is already ranked as the region with the second highest rate of stunting. So their SDGs and associated goals. So their first one was by 2030 to eradicate extreme poverty everywhere. This is defined as living on less than $1.25 a day. Their SDG 2 was by 2030 to end hunger, particularly those in poverty of vulnerable situations, as well as ending all forms of malnutrition. SDG 3 by 2030, and the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combat hepatitis, waterborne diseases, and other communicable diseases. SDG 6 by 2030, achieve universal and equitable access to safe and affordable drinking water for all. SDG 8 by 2030, achieve full and productive employment and decent work for all women and men, including for young people and persons with disabilities, and equal pay for work of equal value. SDG 9 was develop quality, reliability, sustainability, and resilient infrastructure, including regional and transborder infrastructure to support economic development and human well-being with a focus on affordable and equitable access to all. So their interventions. These SDGs all go hand in hand. SDG 9 and 8 work hand in hand to improve economic growth and to help everyone earn equal pay. These two SDGs play into SDG 1, where if the economy is doing well and the people have equal paying jobs, there'll be less poverty, possibly eradicating the extreme poverty that they have. Achieving SDG 1 and eradicating extreme poverty will help to end the hunger and malnutrition, which is SDG 2, as well as help them be able to access clean water and sanitation practices. Achieving clean water, sanitation, and ending hunger will improve their health, since many of these diseases can be passed through unclean water and bad sanitation practices. Help from organizations. So in 2001, the CDC established an office in Ethiopia working closely with their Federal Ministry of Health to address HIV, malaria, tuberculosis, and other diseases. With support from the CDC, Ethiopia continues to reach for the HIV epidemic control by improving active case finding, linkage to treatment, viral load testing, and adherence and retention of existing clients on antiretroviral therapy. Group recommendation and thoughts. Our thoughts are that we should increase the number of medical professionals, hospitals, as well as resources that would benefit not only from the diagnosis of health issues for the people of Ethiopia, but also to help treat them. Increasing the health care provided will hopefully increase the older generation and decrease mortality rates of adolescents. Increasing health care will help the mother-child deaths that occur during birth. encouraging the number of children who obtain education at a secondary level. This could help create more future medical professionals, which would benefit the country and better their HCP to patient ratio. Focus on restoring peace and order within the country as the Tigray civil war is currently disrupting efforts to improve health within Ethiopia at all levels. Collaborating with the UN in order to reach a peaceful conclusion, as well as committing to allowing humanitarian aid into the region on the interim. And just quick talk on COVID-19 in Ethiopia. So, USAID has helped Ethiopia greatly by partnering with them and supplying them with ample financial resources. They are also generous enough to supply Ethiopia with research such as increasing the availability of healthcare necessities like ventilators and O2 concentrators, strengthening lab systems to conduct testing, encouraging public screenings, and so many other things. Ethiopia had 352,504 documented COVID cases. They had 5,888 documented deaths from COVID and 319,989 recovered COVID cases. Our government gave them assistance of $180 million. And here are our references.